have a higher rate of gonorrhea and chlamydia. Men have a higher rate of syphilis. It's found that multiple or new sexual partners without safe practice is an increased risk, but it doesn't mean necessarily they can only have one partner. And they've also found that people that have other influences like under the influence of alcohol or drugs, poverty, unemployment, low education have a higher rate of STIs. Let's see. They also have found that women on a lot of STIs do not show symptoms right away, so they have longer, long-term deficits. And the CD actually has come up with more funding, I don't know where because everything's being cut, to improve the program of educating to strengthen people, get out there, educate for prevention, to decrease the long-term costs. We'll see how that works. But that's something that's happening now that's going to start in 2019, but I don't know where they found the funding because they just cut a lot of things. So, impact on women. Women are more easily transmitted. It's more easily transmitted from men to women because the lining of the vaginal area is thinner than the male penis, and they're more susceptible. They show fewer early symptoms than men, so they don't seek treatment right away. And adolescent female are not fully developed, so their cervix is not fully developed, so they're more vulnerable. Adolescents also have a more physiological inexperience and lack of knowledge and engage in higher risk behavior. And they're less likely to have health insurance or to follow up with a healthcare person. Infants, these are some of the other vulnerable population. Infants, it's transmitted while they're within their mother, but more likely it's transmitted during vaginal birth. So a lot of times they'll have a C-section, so it's not transmitted to them. And that is mainly gonorrhea, chlamydia, and syphilis. Adolescents of both sexes, that's the I'm invincible stage. You can't, I can jump off the roof and survive kind of thing, 15 to 24. And then the older adults, it's increasing because their partner dies. And they say, oh, I don't need any protection. I'm old. I don't have to worry about getting pregnant or this. And they're having a high risk. Because you guys, the villages down in Ocala? high risk. They have parties down there. Let me tell you, I used to work in Ocala. And let me tell you, they party. If you ever want to go somewhere when you're old, go to the villages. They can party. And they come in with all these STIs, and they're like, well, I just met up with Mary Jane, and whoa. Okay, well, how many partners has Mary Jane had? So it trickles down. You sleep with who they slept with, and who they slept with, and who they slept with. And it's one big party down there, so you probably slept with everybody in that village. So risk factors, the multiple partners, but remember, it's more the risky behavior by not taking proper protection. Young adults, more female than males, but between 15 and 24, and adults older than 50. People that have a substance use, they lose their common sense, and they're like more open to trying things, or they sell their body to get the drugs, and they don't take the precautions. Rape victims, or people that have a history with STIs are more of a risk. So, and then they have the swinger parties. There's a lot of them. That's another story. I can't tell you all my stories. So, it starts with the screening. That's where you're going to assess. You're going to go in and talk with them. And you can go to the CDC, and they can give you how to take a sexual history, but basically includes the 5 P's: partners, prevention, protection, practice, and past history. And you want to educate to decrease those risks, right? Because the more you decrease, the less likely they're going to get these ugly, nasty viruses and bacteria. So the long term is we want to prevent transmission of the STIs, and using just a latex condom can cut that down. Can't be like a lambskin or whatever other kind there's out there. And if you're allergic to latex, if you don't use latex, I'm sorry, I guess you just can't have any sexual relationships. Sorry. Well, you can, but you're at a higher risk because do you really know your partner? That's a conversation you have to have with them. And it even is recommended if you are sexually active to get tested, and according to how many new partners you have, you should get tested afterwards. And once you become infected or your partner becomes infected, you want to avoid intercourse because guess what? It's going to spread. And you may not have gave it to your partner. They may have went out, especially in the villages. Use protection. If you have to have intercourse or sexual relationship, it doesn't have to penetrate. It's just body on body kin. And you want to also notify your partner. That's where I got these people. This is the person. What did you do? I said I didn't do anything. Yeah, right. It's not cute. I would be out one. You better not let me find you. All right. So the things you need to know. There is a difference. There's viral, which are the 4 H's. HIV, HPV, which is human papilloma virus, herpes, and hepatitis. There are no cures for viral. They treat symptoms. Then you have the bacterial. If it's caught early enough, you can cure. It can come back. And that's gonorrhea, chlamydia, and syphilis if it's in the early stages. Late stages, you might as well plan your funeral because you're going to die. I'm sorry, I don't want to sound crude, but know the difference. It's going to be very important. What types of organisms cause STIs? Viruses and bacteria. What routes? Genital to anal, genital to genital, oral to genital, oral to anal, skin to skin, kissing, butt, body rubbing. Anything secretion. Mixture of fluids, blood, semen, vaginal secretions, also needle sticks, sharing needles. They get hepatitis a lot. They actually get more hepatitis than HIV from sharing needles. What types of infections can be cured? Bacteria. And what types have no long-term cure? Viruses. And you manage the symptoms. What is the range of consequences when infected? Depends on what it is. Viruses, you're going to treat the symptoms. Bacteria, you're going to irradiate that organism. So we're going to start with genital herpes. There are 2 types of genital herpes. You have SCV1, which is your herpes simplex virus 1. This is the blisters around the mouth, the strain. And then you have HSV2, which is herpes simplex viruses 2, which is more the genital area. Now, you can spread the HSV1 to the genital if you take your mouth and you go down there. And you have a sore. It gains entry via mucocutaneous surfaces. And it pretty much takes over. It multiplies, causes cell destruction, and these vessels form, which are these little pus, clear vesicles up there. And they hurt. They're painful, they're red, and they start showing up usually about 2 to 14 days after exposure. They're still contagious if they don't have those exposed, and they're very painful. The CDC actually reports 776,000 new infections of HSV, with 1 in 6 adults between the ages of 14 and 49, and 1 in 5 and 1 in 9. 1 in 9 in men. 1 in 5 in women, 1 in 9 in men. So the oral is the herpes simplex virus 1, the cold sores. It can cause sore throat, fever, headache, body aches, swollen glands, armpit and groin, in the neck, armpit and groin, the swollen glands. And HSV2 causes the most genital herpes. It's usually 80%, and the 20% is the other migrated down. And remember, women are at greater risk because they have more mucosal membrane closure. And the fluid in those little sores that pops open, it can spread. So early symptoms are burning, itching, painful. You need to teach to wash your hands. Don't itch. I've had a patient sound. You know, you gown, mask, gloves, and you're like, and you go out of the room and you're like, and you get outside and you're like, but you don't do that for the patient. That's why a lot of times I'll wear a mask so they can't see my expression. So I can like see this patient, you know, behind the mask and like throw up. But we can't be judgmental. It's just, I feel like I got it. You know, it's like someone has scabies. I feel like, oh. Even though I don't, and it's not because the patient has it, it's because I know it's on me and I want to sit here and itch. So. There's no cure, but they do start them on antiviral. So the first outbreak usually has a duration of 10 to 20 days. And then reoccurring infections, the severity goes down in a shorter time frame. It becomes more like 4 to 5 days. And how they diagnose this is by presumptive diagnosis, by experience, by looking at it. When you look at it, you're like, ooh, yeah, that's herpes. Because it's very distinct. And there's no cure. And then they'll start them on a cyclovir, Valtrex, Danavir, any of those antiviral meds, and they'll take that daily. And they actually should even take it when they're not. I know some people won't take it if they don't have a flare-up, but it's recommended by CDC to take it continuously every day. They also consider flu-like symptoms, which is that fever, body aches, headache kind of stuff. And also it causes dysuria, where they don't urinate very well, they retain it, and then they have that discharge. They can do a biological test for the virus itself, and that's where you have to go in and do a little swabbing. And you get in there and you swab it. And then you send it off. So what we're going to do, we're going to do what? We're going to assess them, right? We're going to collect the data, we're going to get in there, we're going to look at them. And if you don't know what it is, that's when you go to somebody, hey, I don't know what this is, can you come and look at it with me? And they'll go in and go, yeah, And then they'll walk out and I'll tell you what it is. Because the first time you see stuff, you don't necessarily know what it is, that's when you get someone to look at it. So you're going to assess everything, you're going to ask questions about their sexual history, what's going on, if they've had it before, what happened the last time, all that kind of stuff. Then you're going to come out with your nursing diagnosis. It can be acute pain because it hurts. Knowledge deficit, because most of the time they're like, I don't know how I got this. I just went out, we had a party, and it was one of those kind of parties where you just met up with whoever. But they swore they didn't have anything. Risk for infection. Actually, I'd say they do have an infection. Then you're going to make up a plan. You're going to educate. You're going to make sure they take their medicines. They have the money to buy the medicines because some of those antivirals are very expensive. Follow up, safe sex. Talk to them about latex condoms, future preventions. What happens because, it's a virus, it's not going to go away, it's going to keep coming back. Make sure that make sure their partner knows. They understand what to do at whatever stage it is. Wash your hands. Don't scratch. Follow up with your doctor. And then you're going to evaluate it. Okay. Then you have human papillomavirus, HPV, or genital warts. There's actually 40 types of genital infections. And the one I'm going to talk about is genital warts. It's the most common infection in the United States. Women are greater risk because, what did I say? Mucose, it does that. There's a higher rate of infection on pregnant women or people that are on hormone treatments or have a depressed immune system. And it can also transmit to the baby. Most infected individuals are asymptomatic. They can transmit vaginal, anal, oral, genital contact, usually a 2 to 3 month intubation. They also, CDC recommends 79 million people are affected currently, and 1.4 million each year for this. 90% of the cases clear with no intervention within 2 years, but it can lead to more severe things like different types of cancers. Cervical, but this takes years. Cervical, anus, vaginal. That's why you hear a lot of commercials on the HPV vaccination when you're young, 11 to 12. But they do recommend that women can take it up to the age 26 and men up to the age 21. And it's 2 injections to prevent the cancers from it. So you guys have seen that commercial, right? Did you know, Mom? Did you know, Dad? Did you see that commercial? Did you know that I was going to get this? So what happens? Majority of them don't exhibit, but they can develop these genital warts, and it looks like cauliflower, basically, in the area. You will take a swab, you'll go into that area and you'll swab it and send it off. You will do you'll educate about regular screenings, pap tests, pap smear tests, make sure it's not precancerous lesions going on. And if they are, they seek treatment right away. Pretty much there's no treatment unless they see the genital warts. And when they have the genital warts, they use different topical agents. Podophyllfox is a cream that you usually educate the patient to apply down there. Teach them to wear gloves, apply it, wash your hands. And imiquimod is another cream that applies to the lesion. And like I said, that's usually when they have those genital warts, the cauliflower-looking things. They also have a higher quality that the doctor or you yourself will have to apply. They usually get these once a week. The podophyllum, which is a resin that it has a mixture that stops the growth of it, and trichloroacetic acid, acetic acid, which stops the growth too. And these are very chemical, so you want to make sure that it only gets on the genital wart itself. Usually it just needs one treatment because it burns it off. And you don't want them to put clothing on for an hour. You want it to air dry. And about 4 hours later, you want to rinse it off. They also do other things like interferon. They inject it into the base of the wart to stop it. They do photodynamic therapy where they shine light or they irradiate it to reduce the symptoms. And those, like I said, they usually only treat if they have the warts. And then there's the Gardasil and the vaccine, the several vaccines that I was talking about. So what are you going to do? Same thing, right? You're going to assess them, you're going to talk to them, you're going to find out what's going on, collect the data, then you're going to come up with your nursing diagnosis. It can be anxiety, it can be a lot of different things. Ineffective sexual behaviors, then you're going to come up with a plan and implement it. Education, follow-up care, medications, prevention, and then you're going to evaluate. Were they able to respond to what you taught them? So you're going to have to educate them more than one time. But the main thing for prevention is educate, educate, educate. And provide them with the tools they need to do the prevention. That's what it looks like. Look at cauliflower, right? Who likes cauliflower? Used to like cauliflower. Chlamydia. It's the most common reported bacterial STI in both men and women. It is asymptomatic in most women. It can cause permanent damage to the reproductive system. They get that inflammatory down there, and over time it causes problems. The approximate CDC says approximately 2.9 million are reported affected in U.S., and that has increased 4.7% since 2015. So we're not getting better at that. 3 times more often to happen in 14 to 24-year-olds than older. 1/3 of men are asymptomatic, but men develop reactive arthritis. Multiple sex partners is a risk factor. Not using condoms consistently. History of prior sexually transmitted infections. So apart from being at birth, this is caught by a sexual act. But you got to remember, they don't have to have penetrative sex to get it. The secretions, the fluid, sexual fluid can touch the genitals and they can get it. Actually, I had a patient, no lie, guess what? They named your baby what? But they didn't pronounce it that way. And I'm like, doesn't matter. I'm like, looking at it, I'm like, what an interesting name. Where did you get that? Well, that's what I had when I was pregnant. Oh, okay. Tell me. How many of you have children? How many of you have grade school children? Grade school or teenagers? Do you guys know what rainbow party is? Rainbow parties is where they start. It used to be in middle school, but now it's lower, where girls will wear different colored lipstick, and guess what they do? They give a blowjob to a guy, and the guy that gets the most different colors, the rainbow, wins. They also have these bracelets now. You guys heard about the bracelets? Different colored bracelets mean what they've done. It still happens, even though it started. So you did that when you were in high school? Did you do the vodka tampons? The vodka tampons? Men and girls? Boys and girls?
Oh, I've heard that.
pre-love. We didn't have
oldies.
this. Okay. So, the leading cause is for babies or children is the preventable blindness, as if it's active and they're born, they'll get it in their eyes. And it's an organism called chlamydia trachomatis, and women are more susceptible than men. And that's what it looks like when they go under the microscope. Yeah. That's how they can determine what it is, which everyone has their own significant makeup. So, usually, incubation period is 1 to 3 weeks. May be present for months or years, and they can go away and come back. So, education, right? And it can be still infectious even though it's not active. Late women symptoms, because remember most of them don't usually have symptoms. It usually doesn't start developing or appearing for 1 to 3 weeks, and then women can get later on abnormal vaginal discharge, burning sensation when urinating, itching, bleeding between periods, and they get that abdominal pelvic pain. Men have late symptoms of penile discharge, burning sensation and pain when urinating, and their testicles swell. And potential long-term is few cases the sperm count goes down. It irradiates them. Rectum symptoms, they can have discharge, painful bloody discharge. And long-term, if it's not treated, they develop pelvic inflammatory disease, which the women, it affects their reproductive organs. And chlamydia is the leading cause of preventable infertility and ectopic pregnancy. And the reason why these long-term things happen is because the symptoms, they don't have any symptoms, they don't get checked, and they don't seek treatment. They also, I don't know where that. Did I go over anything? Yeah. So remember, chlamydia and gonorrhea, both, if they don't seek treatment, can affect women and give them PID. So they can do a Gram stain of the discharge and get under the microscope and look and see what it looks like under there. They also add the nucleic acid hybridization test, which checks the DNA and RNA of the strand to see what's going on. And then they also can do the nucleic acid amplifying test, or the NAAT, which you can have the patient self-collect it, or the provider will do it during a pelvic. Have you guys helped the doctor do a pelvic exam and go in and take swabs yet? Has anybody had someone with STI where they went in to do this? Or you had to do it yet? Okay. You will. Okay. So they do that, they take vaginal swabs and penile swabs, they go in and take it from them. The treatment, they usually give them azithromycin orally in 1 dose, or they give them doxycycline for 7 days, and sometimes they'll even give levofloxacin for 7 days. Both partners need to be treated, and they need to abstain from sexual intercourse. But if they can't, they need to wear condoms, but that doesn't mean that it won't transmit, because it's only going to protect that area that's covered, and they can have it spread. So, nursing care diagnosis. You're going to do what? Basically the same thing, right? You're going to collect the data. You're going to give them a diagnosis. You're going to make a plan. You're going to teach them. Teach you, and then you evaluate them. And this is what it looks like. That's what happens to little babies. They get it in their eyes and around the lips. Looks nasty, doesn't it? Okay. You can go ahead and take a break, and then we're going to talk about gonorrhea.